This is Ryan Brown for mockquestions.com. In today's video, we will be discussing 5 mental health counselor interview questions. But before we do that, just a quick disclaimer, these questions are not guaranteed to be asked at your interview. I've pulled all today's questions and answers from our website, mockquestions.com. Now let's get started. Question number 1. Why did you enter a career as a mental health counselor? There are many different motivations for entering the field of mental health, but most reasons stem from the common ground of a desire to help people. Think about why you chose a career as a mental health counselor and what motivates you to do your job every day. Maybe you have dealt with the mental illness of someone close to you, or perhaps you are frustrated with the current model of mental health care, and you strive to make a positive difference. Whatever your motivation, speak openly about how you aim to make an impact through your work as a mental health counselor. I chose to enter a career in mental health because I want to help people learn to cope with life's challenges. It's important to me that I work to make a positive change in society, and I believe that begins with a person's mindset. I think that if a person has the right mental tools, they'll be more resilient in life. This resiliency also creates a positive ripple effect on families and communities. When more people can thrive, our world will become a better place. I am happy with my choice to pursue a career as a mental health counselor, and I look forward to making an impact on others. Question number 2. Mental health counselors require a high degree of fortitude and patience. How have you developed these qualities? As a mental health counselor, you must exercise patience and display professionalism at all times. Patience will help you to sit through challenging sessions and offer unbiased advice to your deserving clients. Patience will also allow you to hold space for those who need to vent, think, and process their emotions. Describe how you grow and practice your patience levels and what role this strong mental fortitude plays in your success as a mental health counselor. I was trained early on in my education how to exercise patience in a way that would ensure a professional delivery at all times. When studying to be a mental health counselor, some of the classes and exercises I completed had to do with helping me obtain good emotional balance during counseling sessions. In class, we often discuss and work through areas where we may struggle as counselors. As a mental health counselor, empathy is an asset, but it's very different from sympathy. Empathy is what drives my high levels of patience, and it means that I can understand my client's view, their world, without immersing myself emotionally. I'm very good at seeing how a hurting client views the world. From there, I can help them to build healthy habits around this information, while also being patient with any setbacks they may experience. Question number 3. What methods do you use to help your clients speak up about their issues and needs? The interviewer would like to know more about your communication style and how you encourage your clients to open up and make the most out of their mental health therapy. Feelings of safety and security are 2 key elements that will help clients feel free to open up to you. As a mental health counselor, it's up to you to create that safe space through the energy you put out and the environment you create. Discuss with your interviewer the tools you use to encourage your clients to express themselves. Be as specific as possible. To help my clients speak up about their issues and needs, I use positive self-regard techniques. I create a non-judgmental environment, and I use open communication to foster a place of trust. These methods help my clients express themselves as I show empathy and give encouraging statements. I also ask non-threatening, open-ended questions that allow them room to talk. I affirm how my client is feeling, and I walk alongside my clients by supporting them and accepting them for who they are. I encourage my clients to explore their past, and I listen to them as they express their concerns for the future. We set clear and achievable goals and work together to accomplish these targets. This teamwork approach helps my clients to feel safe, which allows them to trust me and open up further. Question number 4. What is your biggest weakness as it relates to this mental health counselor role, and what are you doing to improve? The interviewer is looking for red flags or gaps in your knowledge. When you answer this question, a real vulnerability is essential, but be sure to include what you are doing to improve on your weakness. Be honest about your weakness and, at the same time, show that you are proactive and dedicated to professional growth. It's essential to maintain a positive tone, show confidence, and display a desire for growth. Choose a weakness that is not a core skill for the position. Be sure to have an action plan in place for improving on this weakness. Also, be sure to avoid cliche answers such as, "I work too hard," or "I care too much." Be sure to acknowledge your weakness and that you are taking steps to grow in this area. It shows the interviewer that you have initiative and a desire to improve. At times, I struggle with leaving my emotions at the door after a challenging day at work. I do not become emotionally involved with my clients and their stories, but some days are more emotionally draining than others. When I get home, I want my family to get the best of me, so I have started to put better practices in place to compartmentalize my work and home life. On my drive home, I stop and take a 30-minute stroll on the walking path near my home. During this break outdoors, I turn my mind off and I focus on the sights and sounds of nature. This self-care routine has helped me be more consistent with my emotions outside of work. I am also privy to the fact that even counselors need counseling, and I have a counselor whom I trust that I go and see twice per month. I will continue to work on developing more positive habits to help myself adjust between work and home. Question number 5. What have you done in the past 12 months to improve yourself personally and professionally? The interviewer would like to know about the recent actions you have taken to expand your knowledge as a mental health counselor. Discuss the ways you have helped yourself when it comes to personal and professional growth. Continual learning is critical to keeping yourself in check as you work in an emotionally driven environment. Share some of the helpful tools and tips you have recently applied to drive more impact in your personal and work life. I have always taken great care when it comes to my personal and professional growth. I have been taking mindfulness courses to help me thrive on a personal level, but also to gain new therapeutic techniques to use with my clients. I am a strong believer in the helpfulness of journaling as a cognitive behavior therapy technique for addressing mental health issues. For this reason, I continually research and try different journaling techniques. I believe in taking the techniques that I learn and trying them out for myself before I introduce them to my clients. Overall, this year has been a success for me when it comes to expanding my global view and improving my counseling approach. I feel more secure today than I have throughout most of my career, and I believe this is because of the way I've immersed myself in personal and professional growth opportunities. Thank you for watching. If you want more interview practice, head over to mockquestions.com today and get started.